I'm going to tell you about hernia types that are overlooked and about all those patients who come in just a little too late. I'm Dr. BenMaamer, board certified general and vascular surgeon, and early evaluation changes outcome. Most people assume if there is no big bulge, it's not a hernia. It's just a muscle strain. It comes and goes. It doesn't hurt much. It will heal on its own. And that reassurance feels logical until it progresses. Because the most overlooked hernias are the subtle ones. So what's actually happening internally? The most overlooked type are small inguinal hernias, femoral hernias, especially in women, Spiegellian hernia, the hernia that comes on the lateral abdominal wall, and often no visible bulge. So those three, very important to remember. It starts with weakness in the abdominal wall. Muscle tensions hide the defect. With high intra-abdominal pressure that is increasing from either lifting, coughing, straining. So before the pain starts, the patient feels heaviness that becomes pressure, that becomes intermittent discomfort, then becomes pain and sharper pain. This is usually when patients wish they had come in sooner. So hernia versus muscle strain, let's make the difference. For the muscle strain, it improves in weeks. Tender to touch, directly related to activity. For the hernias, they are resistant and persistent. Worse with cough or lifting. Pressure more than soreness may go down when the patient lays down. If discomfort lasts more than 2-3 weeks, it deserves evaluation. So if we decide to make imaging strategy, not every groin, of course, needs a scan. So usually we start with a careful physical exam. Sometimes the physical exam is unclear. We may order an ultrasound. We can even order CT or MRI for very occult cases because precision first, and we don't want to be doing an over-testing. So why people delay? Again, they delay because they are busy. It's tolerable. They were told it's a strain, and just to try to rest, they Google. And of course, the insurance confusion. Delay rarely makes it this easier because hernias do not repair themselves. They will only enlarge. So when this progresses, treatment becomes more involved. For an early stage, small outpatient repair, and the recovery is easy, it's minimal. For later, it will be larger defect. It will be more complex repair. It will have a higher risk of incarceration. What incarceration? Incarceration tissue gets trapped. For strangulation, it's a degree higher. It's blood supply compromised. So surgery becomes urgent. And urgent surgery is always more stressful than planned surgery and worse result. So who are the risk group? Higher risk if you are or if you lift heavy regularly, have chronic coughs, strain from constipation, had prior abdominal surgery, and for people who are overweight, pregnant women. So women with deep groin pain should have an evaluation, even if they don't have an obvious lump. Femoral hernia in women are frequently missed, and this is very important because we see them frequently as an emergency for a strangulated hernia. So what patients should do earlier? The patient who do best, usually they notice the pattern changes. Don't ignore persistent pressure. Seek evaluation when pain doesn't resolve. Ask about imaging when exam is unclear. Early consultation does not commit you to surgery. It gives you clarity. You know, planned surgery is safer than emergent surgery. This is obvious. If this sounds familiar, don't wait for it to become urgent. Schedule an evaluation. Early answers matter. I'm Dr. BenMaamer. If you believe healthcare in America needs to evolve, hit follow. We are building momentum one video at a time.